Governor Josh Shapiro and state lawmakers approved a $20 million increase to county mental health funding in last year's budget. It's the first increase of money those services are seeing since funds were cut by 10% back in 2012. They're proposing the same increase this year. However, mental health advocates say it's not nearly enough. And without serious investments, the system is on the brink of collapse. Tonight, Fox 43's Amy Lutz explains just how deep the blow goes for those organizations on the front lines of what's for years been described as a mental health crisis and how they're getting by on their own for now.
Worker shortages and battling high costs.
People are leaving the mental health field because they're just not making enough, and they're closing programs in Lancaster County because there isn't the funding.
It's something people have become familiar with hearing since the COVID pandemic in 2020. At least 152 million people across the country live in a mental health workforce shortage, according to the most recent data from Mental Health America, with Pennsylvania ranking 33 out of 51 when it comes to the number of people seeking treatment from providers.
I deal with depression, and I wanted to get into counseling, and it's an 18-month wait. I didn't want to wait 18 months.
Mark Kuzner from York County is one of the Pennsylvanians that had to deal with the trickle-down impacts of the budget battle. He says when he first heard about the potential wait to get help, he felt helpless.
A lot of pressure on me, a lot of pressure on my wife and daughter, because of my mood swings.
However, Mark didn't have to wait that long.
When somebody identifies they need help, they need it now.
He found help in the Building Bridges for Brianna therapy program. Launched in September of 2023, people can get 3 free therapy sessions almost immediately. Then each session is $35 until the person is able to get into permanent treatment.
We don't get any funding from the county, from the state, federally. It's all donor-based.
Something the group's founder and president says he has continued to fight for because he doesn't want anyone to experience the same pain he had too when his then 15-year-old daughter Brianna died by suicide.
She wanted to help people that was dealing with the same things that she was going through at that time. So to actually be able to see it happening, it just moves me because she's here.
It's a battle that all goes back to money.
We need to build a concrete infrastructure and system to address the mental health needs.
I wouldn't want to rely on the community members forever to put this on, but to find the funding that's available is very hard to do the niche thing that we're doing.
Dorgan says Building Bridges for Brianna has just expanded its operations. Before, the group could only help York County residents through its therapy program. Now it can accept all Pennsylvanians, and they can even do telehealth appointments. We've got more information on that right now on fox43.com.